Hi, I'm Erin. I'm one of the nurses here at the Miracle Mile Group, and I'm here today with Dr. Parvaz Mizrahi. We are learning about her oral maxillofacial surgery center, and you have two practices, one in Beverly Hills and also here at the Miracle Mile Group. Today, I wanted to talk to you about TMD. Can you explain what that is to me, and what is the difference between that and TMJ?
So Erin, that's a very good question. A lot of the patients come to me and they say, I have TMJ. TMJ is the anatomical name for the joint, which everybody has. So right here we have two temporomandibular joints. When there are problems with it, we call them TMD, temporomandibular dysfunction. So that's the difference.
Okay, thank you. And what causes TMD?
A lot of the problems have multifactorial causes. TMD is definitely one of them. One of the main problems is that people clench or grind their teeth, and the function is all in the masseters or the cheek muscles. A lot of the times this over time leads to TMJ problems, which could be popping and clicking, locking the jaw. It could be locked in the open position or the closed position, or headaches even, that when the patient wakes up they feel like they have a headache, or they have other symptoms. Another cause could be genetic, and another cause, believe it or not, is young woman, because progesterone has a direct effect on TMJ.
Wow, so you were kind of touching base on the symptoms of TMD. So what are these exact symptoms of TMD?
So as I mentioned, TMD has different manifestations. A lot of the times there's popping and clicking, locking off the jaw, or waking up with headaches. A lot of my patients tell me that when I wake up in the morning, I feel like my face is exhausted. Or towards the end of the day, because I spoke a lot, or I chewed a lot, or I use my muscles, I feel like by the end of the day, I can't even talk, I have slurred speech, and my muscles just feel tired and exhausted. But sometimes, as I said, it's headaches, and sometimes, there are no symptoms. I open their mouth and I see that the bone around the teeth have a lot of overgrowth. And that's because they've been putting too much pressure on the teeth, and we call them mandibular or maxillary tori. And they have tori, and I noticed that they have been clenching or grinding their teeth.
We hear a lot of people call in for Botox to use for TMD. Can you tell us how that works and if you think it's beneficial?
Sure, so I've been doing Botox since 2010 for TMD and TMJ problems. One of the problems is that when people clench or grind their teeth, it's mostly done during the nighttime when they're sleeping, and it's done unconsciously. So if they are not aware of it and they cannot control not to clench and grind, I use Botox as a medication to relax their muscles so they don't or they can't clench or grind as much. I don't paralyze those muscles, obviously, because we need them for other purposes such as chewing or kissing or puckering and other stuff, but we do reduce the function of the muscle, so the effect on the joint is much, much less.
That is amazing to learn about. I was wondering too about like night guards and different kinds of things you can use instead of Botox. What are the other options that you have?
So at my practice, I refer to the night guard as a clutch. If a patient has an acute problem, like if they fall or if they had trauma and the TMJs are just in acute pain out of a sudden, I do put them on a night guard or a splint for a very limited time. A lot of my patients come to me and they've been on night guard for a very, very long time, and they even got worse, or they can't tolerate it and they can't sleep without it, with it or without it. So they are not complying with the night guard. With the night guard, the patient or the person still clenches and grinds against the night guard. So it does not reduce the function of the muscle, and as a matter of fact, they do clench more on the night guard. It's just like a pacifier. You put it in the kid's mouth and they just start sucking on it. With the night guard, you just start grinding on it or clenching on it. It does serve the purpose of protecting the teeth, but it definitely does not protect the TMJ, because as I said, they do grind and clench more against the night guard, and the muscles exert much more force on the TMJ, and the TMJ symptoms do get worse with time.
So what do you recommend then if you have TMD and the Botox, or you've tried all the other things? Is there a surgery that you do for TMD, or what's the next step, I guess?
Exactly. So there are different stages. Most of the time, 80 to 90% of the time, my patients do really well with multiple injections of the Botox, and I use the Botox as a medication. So I have to maintain the dose. And they do very well. If the patient goes to locking or they have much more severe symptoms, which are like locking or other like a malfunction of the TMJ, or they get stuck when they're open and close their mouth. I do have further steps that we advance to either procedures or small surgeries. Yes.
So if someone was coming in to get diagnosed for TMJ, what can they expect at their appointment with you? What would happen in that appointment?
So first is the clinical examination, and the most important part of the clinical examination for me for the first visit is to listen to patients' history. I do review their diet, their habits, if they have nail biting habits or they have other habits like biting their lips or stuff. We go over all of that. I try to eliminate functions that are reducible or manipulated, and such as like habits. And nowadays when we all wear masks, people usually don't bite on their nails anymore, but they're definitely much more stressed out. And then after that, if there's any needs for a special CT scan, we have it in both offices, and I can take the CT scan on the same appointment. If not, we do proceed with treatment options.
Oh, thank you so much. That was some great education. And if anyone wants to come in for an appointment, find out and be diagnosed, how can they find you?
They can call my office, or they can go online and ask for a consultation appointment, and we will contact them.
We'll make sure to put that link up for you guys. Thanks so much today.